I'm Carolyn McMakin, and in 1995, I was given a list of frequencies that were used by mostly MDs and osteopaths prior to 1935. And they used them with old, clunky, plug-in-the-wall devices. And this list had frequencies to remove inflammation and scar tissue and stop bleeding. And then there was another part of the list that was all tissues. And I had a microcurrent machine, and my practice partner said, you know, we've got a 2-channel microcurrent. I wonder if the frequencies from Harry's old machine would work on that microcurrent machine. So the first thing I did was, as a manual myofascial therapist, I bruised somebody. Every myofascial therapist in the room done that at least once, right? Okay. So her pain went from a 2 or a 3 up to a 6 or a 7. And I called my practice partner and I said, what do I do? And he said, well, put the frequency on for 18 on channel A and 62 on channel B. And her pain went down from a 6 to a 0. I had no idea what he was talking about because this was before we had done anything with it. And I called him back and said, what did I just do? And he said, that's the frequency to stop bleeding. You bruised her, and it stopped the bleeding. So that's interesting. So FSM has turned into, frequency-specific microcurrent has turned into a whole new paradigm in treatment. And the reason is that the frequencies do exactly what they're alleged to do, and only that. So if you have pain because you got hit in the leg by a bat and you're bleeding, the frequency to stop bleeding is what's going to take your pain down. Frequency for inflammation isn't going to do it because it's not pain from inflammation, it's from bleeding. So it's a very specific technique that is applied by physicians, physical therapists, occupational therapists. I teach seminars, I treat patients, I do research. And the frequencies do exactly what they're alleged to do, and only that. So this is what we know about microcurrent, and that is that the current by itself increases energy production in the cells. So your cells run on ATP, it's a kind of chemical energy. Just the current, without any modulation, without any frequencies. This was done in rat skin in 1982, and then it was repeated in human tissue in 2001, 2002. Increases energy production by 5 times. So it's not just a little bit. So the effect of just the current is what happens to your body if you get 5 times the amount of energy that you had 20, 30 minutes ago. What does that do to the rate of healing and function in the tissue? So all chronic disease is related to inflammation. And on this list, there was a frequency to reduce inflammation, 40 hertz. And I can tell you all that because I published a textbook and it's in the book. So 40 hertz is a frequency to reduce inflammation. So the first time somebody walked in with rheumatoid arthritis and their knee was the size of a cantaloupe roughly, and 45 minutes later it was back to the size of a knee. That was the first time I'd done that, was in 1995. It's like, seriously? Really? We can do that? Basically, when diabetics have ulcers and pain, it's because the blood vessels are clogged off with what can best be described as inflammatory sludge. When you reduce the inflammation in the blood vessels. Now, the first year I treated diabetic neuropathies, we didn't get any place. Like nothing, like no thing, no improvement, 0, zip. I guess we can't treat them. Then I figured out, well, I actually read, and it said it's from the blood vessels. So I changed the treatment protocol to reduce inflammation in the blood vessels. And this is what happened. I taught it. First time I did it was 98, used it for 2 years, started teaching it in 2000, and this lady did this work in 2002 in Texas. So I started teaching frequency-specific microcurrent to find out if it was reproducible. It is. I don't have to be there. Patients use machines at home, practitioners use machines in their office, set a patient up, punch a button, leave the room, you come back, and they're out of pain. So the wound's healed. They didn't have to amputate his toe or his foot. There is over $1 billion in this country spent, $1 billion, on amputations. Not the prep, not the wound care. That's many more billion. Just the people to get far enough that they have to be amputated. And after the work we've done, well, I've been doing this for 17 years. After the work we've done, in my opinion, if I do my job right, nobody should ever have anything amputated. We haven't found anybody this doesn't work on. My challenge has been that I'm one of the better kept secrets in the country because I won't put stuff on the internet that I don't have data about. So I like data. Blinded animal research on inflammation. The reason this research was important, number one, it started out as an unblinded trial at the University of Sydney. And the first group of 10 animals she looked at, the reduction in inflammation with this one frequency combination was 70%. She shut down the study. She shut down the lab. She put everybody in separate rooms and closed the doors because in 25 years of doing research on anti-inflammatory drugs, she'd never seen any drug, prescription or non-prescription, that reduced inflammation by more than 45%. So with everybody blinded, lipoxygenase, that's what LOX stands for. Remember Celebrex and all those? So lipoxygenase-mediated inflammation, you paint this stuff on the mouse's ears, and the ear swells, and that's what they measure. Well, the reason this is relevant is that in 4 minutes, 62% of the swelling was gone. 2 minutes, 30%, so it's half in 2 minutes, all of it in 4 minutes. You could stay on it for longer, but nothing additional happened. The reason LOX inflammation is important is that everybody sitting in this room has it. Absolutely every degenerative disease, everyone, is associated with lipoxygenase-mediated inflammation. COX-mediated inflammation is associated with most acute and subacute illnesses, so they often go together. I got 30% reduction in COX-mediated inflammation, which doesn't sound that good, but it's equivalent to the injectable drug that they give you after surgery to reduce inflammation. It's equivalent to injectable Toradol. You got inflammation? That I can fix. I don't have to do it. There are 1,300 FSM practitioners in the US, handful, there's about 150 in Australia, close to 100 in Ireland, 4 now in the Netherlands, sprinkled around the world. It's reproducible, it's predictable, and it takes you to a new level. So the frequencies to dissolve scarring, when you're seeing a rolfer or a body worker that is working on fascia, if you can dissolve the adhesions between the nerve and the muscle, the fascia relaxes on its own. You start your therapy from a different place. FSM isn't a replacement for everything else in this room. It's an adjunct. If you can eliminate inflammation, if you can reduce scarring, you start from a different place and you proceed more quickly. And you can treat whatever it is that your assessment method tells you to treat. So if you have an MRI, we can treat that. If you do kinesiology, we can treat that. It'll do whatever you tell it to do and only what you tell it to do. So that's why I'm here. How long do the results last? Well, the answer is it depends. I would love to make guarantees. I had one NFL football player who had torn his pectoralis muscle. So they sent him out for me to treat his hamstrings and said, oh yeah, if you can fix his pec muscle, go for it. Well, when he bench pressed 250 pounds and tore his pec. Okay. But when he clenched, it's that big a guy, right? So his right pec was like a country ham. It was bigger than about the size of my thigh. His left one twisted into some kind of Mobius strip. It's like, that's bad looking. Okay. So I put a contact, you put graphite gloves or in wet towels when you're working on athletes because you're using about 300 microamps. Still can't feel it. Anyway, so I used the frequencies to dissolve scarring. 35, 45 minutes later, take the contacts off, and I said, okay, flex it. And they were completely symmetrical, completely. On the left, you could see the little divot where he tore a little section of the pec. It bled down in between the fascial layers, so when he contracted the muscle, it corkscrewed the pec. That was a single treatment, done, never came back. Had one fibromyalgia patient out of the 370 I've treated. It was a one visit fix. He was a police officer. He'd been in the pain unit at OHSU for 2.5, 3 years. Treated him one time. Pain went away. He came back for the second time. He came in at a 70, left at a 0. Came in at a 2, left at a 0. Canceled his third appointment. Came back 2 months later. And he said, I canceled my appointment because I didn't have any pain. I spent the last 2 months taking myself off all my drugs. My pain levels today is a 3. I can live at a 3. That, and then there are the patients where you treat the liver, you treat the gut, you treat the brain, you treat the gut again, you treat the liver. They've been sick for 14 years. They have no idea. Their body doesn't have an idea how to live healthily. So that patient is 15 visits, 20, and you see her once a month just for a lube oil and filter, you know, just maintenance. Now, would she progress faster if he was in the room doing kinesiology and testing us what would be the most advantageous to treat first? Maybe. So the frequencies change the state of the tissue. So it's like water, right? Water is completely stable. Is what makes it last. So I do FSM on a patient, and once they're out of pain, then we have the conversation about, you really need to get off gluten. Your gut's a mess. You need to get an ICAT and find out if those root canals are infected. We need to do some blood work and find out what your vitamin D levels are. I can be the best therapist in the room, and I'm here to tell you, if your vitamin D levels are 12, nothing anybody does is going to last. So how long it lasts, how many treatments does it take, it's completely individual. Does that make sense? You see why? Yes, sir.
Thank you for the answer. What about the condition that is emotionally related or psycho-emotional? Can the current help with that too? Or?
There are frequencies for emotions, there are frequencies for brain parts. So emotions are an emotional experience. So there are frequencies for specific emotions. We have data in PTSD that is extraordinary. When you treat football players, 30-year-old kids, they get pretty beat up, make a lot of money, get their feelings hurt, get really pissed off, get in trouble in the press. You don't talk to football players about their emotions. You know what I'm saying? You just don't even go there. They think you're working on their hamstrings. So my instruction to his therapist in Texas was, next time you see him, you run anger, resentment, hurt feelings, fear, grief, and you do those 20 minutes at a time. For the 6 months that she treated him, he wasn't in the newspaper, didn't get in trouble with the team, no fines, showed up on time. She stopped treating him. 2 weeks later, he was in the papers. So yes, there are frequencies for emotions, and your emotions are mediated by the brain. Had a patient at a seminar, anxious, a cardiologist, anxious, jumping out of his skin for 6 years. The frequency that put him to sleep, and when he woke up, different guy. It's toxicity in the midbrain, which is where the amygdala is. Go figure. So yes, there are frequencies for emotions, and brain parts and brain function. So if you quiet down the amygdala and you quiet down the brainstem, what's that going to do to inflammation? I can do that. It's very specific, completely reproducible. So yeah, it's pretty extraordinary. And like I said, the fun part with FSM is reproducible. Now, if anybody in this room goes to one of our practitioners that's in this area, every practitioner uses FSM within their own lens, right? So the chiropractors use it one way, the MDs use it another way, the PTs use it another way, physical therapists, psychiatrists use it another way, surgeons use it another way. So it's a tool, and the therapists can access it within the framework, and you can ask them to use it in a way that is particularly useful or speaks to you. Yes?
Too bad there aren't any seminars on this around.
Oh, right. And if you have, it's too bad there aren't any seminars. I'm going to be back in Washington, D.C. Thank you, Jim. September, is it 12th, 13th, and 14th? I think it's the 12th, 13th, and 14th. We'll be doing a seminar on Bethesda. So if you have a practitioner whose license includes the ability to use electrical stim, I have seminar flyers over here and frequently asked questions brochures. We have the published papers on the website. So send a practitioner, or if you are a practitioner whose scope includes the ability to use electrical stim, come and visit us in September. That would be fun. Thank you for the reminder. I get all excited.
I was a research scientist, I covered a few fields. I started in paleontology and evolutionary biology, and then went to population dynamics and ecology and marine science, and then into analytical chemistry, and then now neurology. So covered a few of the fields. But I started out just interested in everything, and so I moved to Australia as an analytical chemist, and was setting up a marine pollution monitoring program for the state of Victoria when I had a scuba diving accident, and that left me paralyzed from the neck down, and then from T9 down as a paraplegic. And in that process of, trying to recover from that, I was told you'd never walk again, and from the overt damage, it looked like I would never walk again. But I had a unique set of skills and gifts, one of those being a fairly photographic memory, and I had taught anatomy and physiology for 9 years in university, so I can visualize the nervous system in 3D in my head. And I also have been a fairly high-level martial artist, so I could break bricks and boards. You're moving energy with your mind. You use your hand to deliver the energy, but it's the energy, the chi, that breaks the board, not the fist. You punch a board, you're going to get a bloody hand, but you use chi. I'm not going to do that. and the board will break. And so I was in a rehab hospital and doing what everyone else did for the first week or two, and that is pissing and moaning, why me, it's not fair, why me? It's not fair to become crippled. But you know what? Move legs, nothing happened. So fair or not, I was paralyzed from the waist down. So then I said, okay, what can I do about this? And I didn't have much of a clue at the time. And so I said, well, I'll try something that I can do, and that's move chi with my mind. I know all the nerve pathways. So I pick a muscle, my leg doesn't work, and I'll just move chi down that pathway to see if I can reactivate the muscle. I had no idea if I could. And that's what I did. And so sometimes it took days, and sometimes it took months, sometimes it took hours of just moving chi to a specific muscle. And then suddenly I would contact the muscle. It didn't move, nothing happened, but it was my leg, not your leg. And then I would go to the physiotherapist and say, what exercise do I need to do to activate that muscle? And then I'd find out what the exercise was, and then I would just, in my mind, visualize doing that exercise over and over again as I ran chi. And then all of a sudden, look, my foot moved, it moved. Didn't come off the floor or anything. And so then eventually, and I'd be able to start moving, and then it gets better and better and better. And once I could do that, then I'd put a half a kilo weight on my ankle and be right back to trying to move it 1 kilo, 2 kilos, 5 kilos, another muscle. And I just did muscle after muscle. It just took about a year every day, 8 hours a day, 7 days a week. And I walked out of the hospital with 2 arm crutches rather than in a wheelchair. But I was walking kind of like a cerebral palsy person. I'd arch my feet and drag my toes. And I had the first 2 canes and then 1 cane. And so I wanted to walk better than that. So I said, well, I've done everything I can do. Western medicine is everything they could do. Well, I'll try alternative things. I know nothing about it. And I have to say, you know, coming from an analytical chemist point of view, a lot of it seemed pretty woo-woo, you know, I mean, and it didn't seem to have a lot of basis that I could understand. Of course, I didn't know anything about energy systems of the body. So, of course, my skepticism was pretty much based in ignorance, but we all do that. And so I said, but I'm going to give them a fair try. If they say it takes 3 months, 6 months, I should see some change, I'll give it 3 months, 6 months. And if it doesn't change, that just means it's not what I need. And I just kept going to, you know, therapists and one therapy after another. And so I happened to have a friend that said, look, I just saw this kinesiologist today. You know, he's a doctor from New Zealand. He does this kinesiology stuff with acupressure, and, you know, his name's Bruce Dew, and I think it might help you. I said, great, that sounds like it's very interesting. He said, I made an appointment for you at 2 o'clock. Can you go? You know, nudge, nudge, hint, hint. So, and I could go. So I went. And an hour and a half later, after having one of the more unusual experiences of all the weird things I was doing, you know, watching my arm go up and down and wiggling, touching points and stuff that I couldn't understand in any shape or form, I just thought, boy, this is weird stuff, you know. He said, get up, and I got up and walked out of there without using my cane, walked my feet underneath me, and I had steel plates on my tips of my shoes. I'd wear them off once a month, and they were now, I had the same shoes I had 5 years ago. Right, so a profound reorganization of my neurology more than 2.5 years after my accident, which is impossible neurologically, according to neurophysiology that I taught. And so that meant it must not be impossible, which means our model must not be complete. Because if our model was complete, then it would be impossible. And what was the incomplete part was the energy part, was the fact that chi can affect physiology. And then I became very interested, and I started taking kinesiology courses and studying the Chinese system and the Chakranadi system of the Indian system, and, you know, we get to really understand energy systems and also understand this incredible tool called kinesiology. Now, I don't know if everyone here knows what kinesiology is, but it's using muscle feedback basically as a tool to access a whole lot of the subconscious functions that are going on in your body. Now, we think we run our muscles, right? You're standing here. Okay, I'm not going left gas, quadrip, up, right gas, up. I'm not saying anything. I say stand up, and then that's my last conscious thought. Okay, so who's running my body clearly isn't my consciousness, so we're falling down on the floor, right? Who's running my body is a whole integrated subconscious system with a lot of different neural signals going back and forth. And I have no idea about that at all, other than the fact that the body's doing what I asked it to do, so I'm fine, you know, consciously, and it's a good thing it works that way, otherwise you'd never be able to walk down the street. You know, certainly not do that and think of what you're going to have for dinner, you know, so it's this incredible feedback tool, because the muscle responds. So I say hold and I apply pressure, and it could lock or unlock. When it unlocks, I'm trying just as hard consciously, in fact even more so, consciously to hold my arm up, but yet my arm is doing something totally independently from my consciousness, which is not my normal experience. Normally what I say, the body does, if I can, you know. And so how does this work? Well, a very good and simple analogy is there's a whole set of muscle circuits that are totally subconscious, run our basic system. They're mostly reflex systems, spinal reflexes, cross-extensor flexor reflexes, you know, writing reflexes. These go to the spine and back and send information up and down to the brainstem. Never get anywhere near the conscious part of our brain. But it's a good thing too, because you just screw it up. You have to think about it the whole time. And they do really well all by themselves because they're wired to do that, right? And so this whole system provides you with the possibility of saying, hold there, right? But that's the consciousness when that system is in tune and when all the receptors are actually able to fire. But if something inhibits one of those receptors subconsciously, you still say, hold there, and it goes, why? It's a very simple analogy. It's like you have a 100-watt light bulb, and you have a light switch. So you choose to turn the switch on or turn the switch off, right? But there's a dimmer switch. In this case, you don't control the dimmer switch. You only control the on-off switch. So if someone goes over and turns the dimmer switch down, when you turn it on, it doesn't make it any brighter. It stays 40 watts. It's a 100-watt light bulb. Yep, but it's getting 40 watts of power. And you know what? No matter how hard I push on the switch, it's not going to make the light any brighter until I turn the dimmer switch up. Guess who runs the dimmer switch? Our subconscious. And so that's why we can consciously say, hold, and have this happen, because some subconscious component, it could be psychological, psycho-emotional, it could be structural, it could be physical, it could be nutritional. One of the most powerful aspects of kinesiology is it interfaces with all of your primary domains of being, from the structural all the way through the psycho-emotional and spiritual. And so the same muscle can indicate many different things. And then some genius, this guy named Alan Beardall, who did a number of things in kinesiology, has really changed and basically created energetic kinesiology, because he did two things. He developed a system of holding frequency information in a neurological circuit over time. We call it pause lock. Right? So, and I can show you some of this in a second. And the other one is he discovered that you've all seen people like meditating with their fingers like this, right? That's a mudra. In the yogic system, they say this makes a particular energetic connection that has a physiological consequence and helps maintain a calm and centered state of mind. And there's other mudras, if you look there's a whole book of mudras, and each one, when you do breathe in certain ways, has certain physiological effects. This is part of the Ayurvedic system and the yogi system, and in fact they use it as a healing system. And so this has been known for a long time, thousands of years. But Alan Beardall happened to notice, he was working with a client that had a tensor fasciatus, that's muscle here, and you lift the leg up and you try to push it down toward the other leg. And this was really weak, you know. And so he had turned around and wrote something in his notes, came back, and he just went, test the muscle again, like a rock. He went, what? And he looked down and noticed the man was holding his thumb and his index finger together, just on the table, just like this. Open your hand, touch your fingers. That was the birth of hand modes in kinesiology. It's a mudra. It makes an energetic connection, and when the frequencies match, it changes the muscle response. So that told him it was a structural problem, not a physiological problem, not a nutritional problem. So now he knew the domain to go to look to see if he could solve the problem, right? And so we have that whole set of tools that work through these primary energy systems of the body, the chakranadi system and the acupuncture meridian system. And then many of the therapies can be chakra corrections or acupressure corrections. And some of them are really quite profound and quite simple. Others have a much greater deal of knowledge you need. And so, does anyone here, I just have some of the, to talk about kinesiology is one thing, to see it's another. So, could I just have someone come up here that would like to be muscle tested? Yeah? Yeah. Okay. So I'm just going to have in your name Rebecca. Yeah. I'm just going to Rebecca. Now, it's going to be very simple. So first I have to know does her arm or her muscle have integrity of neural function in that circuit? Because muscles have circuits, right? So I'm going to have you take this arm and just put it straight forward like that and like that. And all I'm going to do is apply pressure on your wrist, and I want you to resist but not push up. So you're not going push, push, push. You're just going to hold, and you're equaling my pressure. Okay? Okay, so I want you to hold. And that's, I could push harder, and I'm sure I could overpower her. But I'm not looking at strength. I'm looking at integrity of neural flow. So now I'm going to see if that muscle's working, because she might have a state of imbalance that I'm strong, where the muscle is in a highly compensated state, or it could be in homeostasis. So I'm going to go to sensors in her muscle That the muscle's way up here. I'm going to do the sensors in the muscle and give a signal to see if the muscle responds to the signal.
You want me to put it down?
No, you have to hold up.
Okay.
So you're going to hold there, and I'm going to come here and go boop. If I go boop, if I go like that, it gets strong. Do that, it gets
Yeah.
weak.
Yeah.
Now, it doesn't get weak. I just inhibited the muscle. How would I do that? There are sensors in her muscle that tell the brain how tight the muscle is. So I went in and jammed the spindle cells together, which said, the muscle's too tight, subconsciously. The subconscious said, relax arm. Her conscious said, hold up arm. You saw who won, who actually should win, because that's who's protecting you from your stupidity, right? You can be consciously really stupid, but generally the subconscious isn't, right? And so therefore, it was doing what it should. So it told me that the muscle A is in total and in balance, right? So then I can use that as an indicator to find out something else. Okay, so one thing I can do is have you hold there, okay? And I can check a mudra. And said, well, looks like her chakras are okay. Okay, because if I held the mudra for chakra, then that would, and it changed, then I'd find out which chakra it was, right? And so that it gives me a tool, an assessment tool that's really, so I can just come to here, and I could also check and see if there's a muscle imbalance. It says someplace in her body is a muscle imbalance. But what about, she has 406 muscles, which one? Well, it's 205 that are, there's some that are bilateral. So which one is it going to be? I don't know. So, but she can tell me. And I just used Alan Beardo's other thing, is what I did is I'm going to open my mouth and fire thousands of receptors in my jaw joints that create a signal that basically holds the frequency that of my holding here, right? So, and then I'm going, but the it's not very useful when dealing with the client. So I can just open, I'm still holding this mudra, so I can open my mouth and bring my feet together, firing tens of thousands of hip joint receptors. Now I can talk. But the frequencies here are just keeping that signal. It's just like you put it, just like you stored it in your computer, right? And so now that I've put it there, I can come out and find it says, yep, there's a muscle, but which one? I'm going to come to a set of points. This is an active point, and hold there. And so you notice if I touch here, it says not that one, not that one. So it told me that it's a lung-related muscle. Since it's that limits the number of muscles that it could be. There's quite a few still. But how do I know? Well, I can just look at this, and since it's short on both sides, just bring your arm up this way. Just bend your arm like that. So bend your elbow. Like that. No, it's like this. So the middle deltoid, okay? And it says that's not the one, okay? Well, what's another lung-related muscle? Anterior serratus. Again, the joint come up, straight up like this, and like that right there. Okay, and hold here, and if I put this down here and relax your arm, it says there's a muscle that's out of balance. It's on the lung meridian, because it says that's the lung alarm point, and it must be, hold up like this, hold there, anterior serratus, because it changed so now I can test the muscle to see, is it really true?
Which muscle is that?
It's a muscle that comes from here, right from the border of your scapula to the ribs cage along here. Know these muscles you see?
You're good. I have tendonitis or something going on there. That's pretty remarkable.
Well, so now what we want to do, I don't know that. Her body's telling me where the stresses are, right? So, but we can go one more thing. So let's just have you, now you're going to put this arm up like this. Okay, so you're going to put the straight arm up, straight
Okay.
like that.
All right.
And a little more, turn around this way, facing me like this. Okay, elbow straight. And I'm going to try to pull forward, and you're going to try to hold back.
Okay.
Okay, and hold there. And you notice it says that muscle is under some kind of stress that's causing that. So I'm going to hold that again. And I'm going to use my jaw thing here again. And take it down my hips. So now I can let go of that. What I've done now is put whatever the stressor that's in there that's causing that muscle to be weak. And if I come over here, it says, yep, that's a stress, you're right. So I can check and see if it's an acupressure correction, It's a law of 5 elements correction. Now, these are called mudras again. And so I was just holding my thumb to the crease of my finger. This tells me it's law of 5 elements. That's the center point of Chinese medicine. And it's incredible, it's how the energy systems flow. Now I have the unusual case that I can see the law of 5 elements in my head in color. So, it's a little easier for me to do than most people. So it told me it's law of 5 elements. So I'm gonna come to here, and I'm gonna put 5 elements in circuit. And now I'm gonna just touch my 5 fingers around your navel like this. I'm gonna come here, there. So it's something to fire. So it could be pericardium, heart, where's your belly button? Right there?
Yeah.
Okay. Triple heater. Okay, so I know that triple heater has too much energy. So what the 5 elements is where's the over energy, where's the under energy? Then I know which points to move it. So I'm going to now push just a little more deeply into it. I'll tell people that's why I do that. So there. So things like one there. So it could be stomach, spleen. So I know I need to move the energy from triple heater to spleen. And then I just look in my head and I can see that's going to be pericardium 6 because I have to move it to the inside, and pericardium 6 to lung 10. And so, this is just, this is how it works, okay? Because that's the fire point. And so, let me see, what's that? Pericardium 6 is, I'm going to just do this acupressure. So that's right there, and I'll do it over here also. Just move it a little, there we go. So all I'm doing is just holding and putting pressure on pericardium 6. But you notice that she told me everything. All I went to the dummy pushes on the arm and knows what questions to ask. Because I don't know which muscle of hers was the one. I don't know which points are involved. But she told me that. And I'm just waiting for the points will pulse when they start to come into equilibration. That means the energy is moving, okay? So that's pericardium 6, and lung 10 is right here. So now I'm going to just hold lung 10 and pressure on that. I think it's amazing. The law of 5 elements, there's 670 acupoints that cover pretty much every surface of your body. But the law of 5 elements are 80 acupoints that move more the major energy flows in the body. They're all located below the elbows and below the knees, on the hands and wrists and the ankles and feet. I thought, isn't that amazing? Well, thank you, Lord. That makes it much easier to do this work.
So what does this do now? You're
But
bringing...
what I'm doing is moving the chi to where there was it was blocked, and there was too much chi in triple heater.
Got it.
Okay.
It's
And now
balanced.
it's moving into lung. Now that would tell me that that's ministerial fire. And it's it's basically about responsibility and things like this. And it's moving down to lung, which in its negative side is grief and sadness, but in its positive side is about tolerance. Okay, and so the psycho-emotional components. Oh, by the points, they don't just say there's energy points. They have matched these over 5,000 years with the associated emotions, with the nutrition. There's all kinds of things, the connections. Okay, so it went pulse, 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 and now we're going to take this arm and put it back up here it was before. And I'm going to try to pull forward, you're going to hold there.
Okay.
And I'm going to do that again. And so he says, oh, that's now back in balance. And how did it feel when I tested it?
It feels a little better.
Yeah, with is only one. You have to do more than one thing for that. But
Yeah.
but that was just the first. So then I would find out which other things I had to do. But in a short time, she would have, the shoulder pain would go away. But it doesn't go away. It actually is healing the tissue because it's allowing the energy to move from where there's too much to where it's too little, which allows to reestablish homeostasis of function. Okay? So now that was a very physical thing. Now I'll show you something else that's quite interesting, because what I do a lot of my work, the Lord directs you in different ways that you do not necessarily plan to go. One of them was going into this work rather than as research scientist. But the other was to work with children. I need you still here.
Oh, yeah.
Okay. Yeah. The other is to, is to do things that you don't have any particular idea you would be interested in. And one of these is working with children with learning problems. Now, I was a highly gifted learner, but I did notice that some of my best friends, were dyslexic, they couldn't read very well, they couldn't comprehend. But to me, from talking with them, they were intelligent. But so how come they couldn't read? How come they couldn't spell? Why they had such a hard time with math? That I always used to wonder about this, because it just didn't seem reasonable if it was about intelligence, and they were intelligent, that they couldn't do what you're supposed to be able to do if you're intelligent, which is read and do math and spell, right? And so I had always had that thing, but so there's some of the early kinesiology that I started with, Brain Gym and One Brain Kinesiology, purported to work with kids with learning problems and dyslexia. And so I ended up working with people who had these conditions, but then going and drawing on my knowledge in neurology and going into creating a much more complex and kind of accurate model of brain function, looking at, rather than they were more global systems. I really looked at it much more hierarchy of the brain and brain function. So I developed a test so you can see if the two sides of the brain talk to each other. That's one of the most important things your brain does, because this side does a whole set of functions. This side over here does a whole set of different functions. And if you get the two together, you get even a third level of function. So most of you know that people can problem solve, they can multitask, they can take lateral thinking, we call it, see things from different perspectives. They call these the executive functions, right? And so they look for a long time to find where in this brain is that essential executive? Where is that part of the brain that does this stuff? They never found it. You know why? Because it doesn't exist. It's not brain real estate. It's the dynamic integration of the right and left frontal brain functions that give you an emergent property that neither of them has by itself. And it's dependent on that integration. So when the integration drops out, these functions drop out. Have you ever noticed when you become very angry, you're not particularly creative? You're not a very good problem solver. You're not multitasking, right? Now, why is that? And the other thing you're not doing is accessing transcendent emotions. So the transcendent emotions are accessed through the prefrontal cortex in the frontal lobes. And what are they? Unconditional love, forgiveness, altruism, compassion, empathy. These are things where you have to go beyond, you have to transcend your personal ego in order to access them, right? And so when you get angry, you don't have a lot of compassion. You don't have a lot of empathy. It's damn hard to forgive. The ego says, get even. It doesn't say, oh, I forgive you for doing that. No, it's, I want to get even. Revenge. That's the ego. But if you transcend the ego, you can go to a higher place within yourself. But you need that integration to do so. So we're just going to come here now. I'm now making a combination of mudras and holding these. And we just said her cortex. I'd have you take this arm, and you're going to put it out that way. You're going to push out that way. I'm going to pull toward me. This is just making sure the arm works. Okay, so just face me a little more. Okay, and then to put this arm out here, you're going to do the same thing. You're going to push out that way. I'm going to push over this way. So that just says there's nothing wrong with the muscles that are running the arm. This brain says I can run that arm. That brain says I can run that arm. Now put them both out. I'm going to push them both together. I'm going to hold them both apart. And so right now that's good, because she says I can, because to do that means this brain has to tell that brain how hard it's pushing to equal the pressure on this side with that side. And that's a lot of flow back and forth across the brain.
The corpus callosum, right?
So the corpus, right, so the corpus callosum is working right now.
Right.
Okay, but can you think of an issue in your life that has created a little stress for you?
Oh, yes.
I mean, just pick one. I mean, that's the thing. Yeah, pick a particular one.
Sure.
Okay, just think about it.
Okay.
Okay, so I don't even know. Okay, so now put both hands up and out, and hold them out there, and think of that issue. What happened? She just became less creative, and a little less problem solving, and a little less transcendent. Because this is what happens when you lose the integration, when you are facing a stress issue. Right? So this is the kind of thing you can do. So I just wanted to show that how much information and how rapidly you can gain information. And then we can find out why that's there, and there's even just simple acupressure things we could do that could change that. So thank you so much.
Thank you very much.
You're having too much fun.
Oh, And if you would like, Amazon has a book called Energetic Kinesiology by this weird guy called Charles Krebs and his partner, Tanya McGowan. So this is the first textbook in the field of energetic kinesiology, and it will give you a very good overview. So I just wanted to make you aware of that. And it will give you a lot more insight. Thank you.